Out-of-control cell growth is believed to be the leading cause of death worldwide. Better known as cancer, it can affect several areas of the body, such as the lungs and the stomach. Females are more likely to be diagnosed in one specific area of the body, the breast.
Your breast is composed of two different types of cells. You have lobules, which is where the milk is made, and ducts, which is where the milk flows out. Either of these cells can grow in an uncontrolled manner, and essentially all breast cancer is when these cells start growing in an uncontrolled manner out of their boundaries. The majority of breast cancer is found by either mammograms or by a woman who feels a palpable lump. About 30% of breast cancer is palpated by the patient, so regular self-breast exams are really a good thing. About 70% of breast cancers are found by mammograms, so mammogram screening is still a very good thing, and it helps us to find cancers often before they're palpable. Mammograms should start with a baseline between 35 and 40, and then a regular mammogram on a yearly basis after 40 years of age.
After breast cancer has been identified, tests are done to determine whether cancer cells have spread within the breast or to other parts of the body.
All cancer is staged between stage 1 and stage 4. The stage tells the extent of the cancer. Stage 1 is an early cancer, stage 4 is a late cancer. Breast cancer is staged in the same manner, and it's staged by three different things. It's staged by the size, it's staged by whether it's invaded into the lymph nodes or not, and it's staged by whether it goes to other parts of the body. The fancy word we use for that is metastasis. An early breast cancer would be a cancer that is less than 2 centimeters, has not gone to any of the lymph nodes, and has not gone anywhere else in the body. A late breast cancer, a stage 4 breast cancer, would be a cancer that has traveled to another part of the body. In addition to stage, which tells the extent of breast cancer, there are different types of breast cancer. Some of our breast cancers are very non-aggressive and don't need aggressive treatment. Some of our breast cancers are very aggressive, and those women need aggressive treatment in order to cure them.
No matter how aggressive the cancer is, there is a team of doctors working to contain and eliminate it.
Breast cancer is typically treated by a team of doctors. It's treated by a surgeon, that's what I am, and it's treated by a medical oncologist. The medical oncologist will help you to determine if you need chemotherapy or not, and it's treated often by a radiation oncologist. And that team of doctors put together, all treating with their own specialty, helps us to cure breast cancer often.
Though there are some risk factors that can't be altered, a healthy lifestyle can lower the risk of cancer.
Your two biggest risk factors for getting breast cancer are being female and getting older. You can't help those two factors. However, there are some things that we can do in our lifestyle to help decrease our risk of breast cancer. Number one, our weight. Women who have a higher weight have a higher risk of breast cancer. The second is an active lifestyle. Women who exercise on a regular basis tend to have less risk of breast cancer. Diet is important, and decreasing our alcohol intake. Women who drink more than 2 to 3 drinks of alcohol a night have an increased risk of breast cancer. Men can also get breast cancer. About 1% of all breast cancer occurs in men. It's not common, but it does happen. Men usually present as a palpable mass or lump in their chest wall because we don't typically get mammograms on men. So if men do feel a new lump in their chest wall area, then they need to be investigated and see a doctor also. The good news about breast cancer is the majority of women do really well. Although still too many women die from breast cancer, the majority of women, when they find their breast cancer early, have a very treatable and often curable breast cancer. Treatment for breast cancer is improving every day, every year, and hopefully one day we'll have a prevention for this to eradicate it completely.
To find out more information on breast cancer and on Dr. Templeton's practice, visit her website at templetonbreastcare.com. For Healthwise, I'm Kara Blake.